Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. How are you this morning?
Doing quite well, Katie. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions, addressing the latest headlines, and our lone U.S. COVID statistic through today, July 10th. We invite you to submit any questions or comments you have down below or at any of our social media linked in the description. Starting with those COVID numbers. Average COVID deaths per day in the last reported week were 25 daily. In the same week in 2024, we saw 45 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the state of COVID here in the US?
Yeah, really no change. This is the bottom. We're at the nadir. And remember, in the last couple of years, since COVID started, we always had a peak in August. We had the summer bump, and then we have the bigger winter bump. So this may be as low as it goes. It's been like this for a couple of weeks now. It's lower than a year before. So maybe if this trend continues next year, it'll be half of this amount. So it remains to be seen.
Remains to be seen. And as we look forward to these upcoming respiratory seasons, we have a couple of questions from different viewers along the same lines. They ask, will we have the seasonal vaccines available this fall? And specifically, will the Novavax COVID vaccine be available?
The answer is yes. Vaccines are going to be available from the major manufacturers this fall. And the difference is there's two differences there's a difference between all three, but it's basically the Pfizer and Moderna are the mRNA vaccines, those original ones, and the Novavax is the more traditionally designed vaccine. It's not as easy to make the traditional ones. It takes longer. They're harder to update. Totally doable, but it takes a while longer. So the target for the Novavax one is a slightly older variant than the new ones. They can switch very quickly. But probably they're going to work the same. I wouldn't really worry about that. The approvals have occurred, but the big change in the Department of Health and Human Services and CDC approvals is that the COVID vaccination was removed from the immunization schedule for pregnant women, and we're gonna actually talk about the response to that in the next section here. There were other things that happened in this in the vaccine world here recently. There was an expansion in the recommendation for the RSV vaccine. That's respiratory syncytial virus vaccine. And what they did was they approved it for people 50 to 59 who have underlying disease. So that's an expansion of the group that can take the RSV vaccine. Otherwise, it's 60 and older, and the recommendation was approved with a 14-0 vote with one abstention. And that's just a single dose. You don't have to take a booster or 2 doses or anything like that. They also, the CDC also endorsed the previous ACIP member. That's the committee that used to, well, still approves them, but the committee, of course, has been changed. They also recommended approval for the GSK, GlaxoSmithKline, pentavalent Neisseria meningitis. That's the meningitis that occurs on like college campuses and in groups of people. And it's recommended for people 16 to 23 years old, healthy people, because that's who gets Neisseria meningitis. It covers, the recommendation applies to healthy people, and when shared clinical decision-making favors administration It also covers people's age 10 years of age and older. Say if there's an outbreak in a town or some area, which is how this thing usually spreads if they're increase. And there already is another approved vaccine made by Pfizer that is called Prenbrea, and that was approved 2 years ago. So we have these two vaccines now for those people that are at risk.
That is very good news. But digging into what you said regarding those recommendations for pregnant women, there was actually this week a lawsuit filed against the health agencies, the Health and Human Services, and the secretary from some major health organizations on that topic. Can you break it down for us?
Yeah, so this is what I mentioned about the COVID vaccine was removed from the immunization schedule for pregnant women. Now, there have been multiple studies. We've talked about them on this program. It's full public information. These studies are published in the literature. They're large studies with thousands of pregnant women. And that shows that women who take the vaccine during pregnancy, two things. One, of course, they get less COVID or they get less severe COVID. They have fewer miscarriages, fewer deaths, fewer, it works and it's safe in pregnancy. So it's safer taking the vaccine than not taking the vaccine. You have to consider pregnancy is sort of an immunodeficiency. That's a natural thing so that the mother doesn't reject the baby. Um, and that's just life there. The other thing is that the antibodies that the mother make are passed to the baby, so the babies have protection too. So removing this from the immunization schedule is against the scientific advice of the past approval ACIP committee and just all the knowledge that is out there prompted some very high-powered agencies and groups to get together and file this lawsuit. This includes the American Public Health Association, the American Academy of Pediatrics, which is based in the Chicago area, the Infectious Disease Society of America, which is led by Tina Tan at Larry Children's Hospital at Northwestern, the American College of Physicians, which publishes one of the most prestigious journals in the medical field, and the Society for Maternal Fetal Medicine, and the Massachusetts Public Health Alliance. This lawsuit specifically seeks to restore COVID vaccines to the list of recommended immunizations for healthy children and pregnant women. So the reason that the lawsuit is filed, I mean, first of all, they disagree, but it's more than just, okay, some smart people disagree. It's insurance companies may not approve the vaccine, coverage of the vaccine based on the US government recommendations. Now, those groups are working with insurance companies and they're developing their own immunization schedules that they think are based on science, and which they are. And they're trying to convince the insurance companies to continue to cover them. Now, there's no law that says if the federal government says this, the insurance companies will pay, but they just use that as a benchmark. It's been used for years, and it's kind of the easiest way. But now, we don't know really what's going to happen. But if those pregnant women don't get the vaccine because they can't afford it, or they want to follow the government guidelines, it's going to cause more miscarriages, stillbirths. I mean, all the bad things that can happen in pregnancy are more if that woman gets COVID. So this is not a safety issue. In the lawsuit is a person at risk. So this is the person is Jane Doe. That's not, of course, not a real name. She happens to be a physician at a hospital who is 20 weeks pregnant and who claims, really, that she's at increased risk of exposure to COVID because she's increased risk because she's more exposed to people more likely to have COVID. And so she's the plaintiff, the person that's a plaintiff, and those agencies I mentioned are going to support her. So, we'll see what happens. But I mean, it just is a very sad moment here in this whole medical prevention world, preventing disease world, prevention. It's very sad, but they're going to fight it, and we'll see what happens.
Absolutely. It should be noted that at the height of the pandemic, before the vaccines were widely available to the public, there was a 50-year high of maternal death during pregnancy and just after birth. So we have staggering significant numbers and data that show how dangerous COVID can be for pregnant women. It is staggering.
It's very staggering. It's very upsetting.
Mhm. And another upsetting statistic we're reporting this week is that the United States has officially surpassed the 2019 record high of measles cases here in the country, the highest since we eliminated the disease in 2000. Can you break it down for us?
Yeah, there's as of last Tuesday, the CDC confirmed it's 1,288 measles cases. Okay, that's a record since the number of cases was zero in the year 2000. Go from zero to 12, almost 1,300. And we're like just in the middle of the year, so it's going to go higher. Of course, 3 people have died, which is typical. 1 to 2 people typically die from measles per 1,000. Okay. Um, Last year, there were 285 cases, to put it in some kind of perspective. So this is already 5 times greater in the first half of the next year. So if we keep going at this rate, it's going to be, 10 times greater. Um, it started, of course, in Texas, but that has now spread to New Mexico, Kansas, Oklahoma, Colorado, and actually many other states. Almost all the cases are in uh, people who are unvaccinated or have an unknown vaccine status, well over like 92% or greater. Remember, the vaccine is very effective, but it's not 100%. It's 97%. And when we had almost 95% vaccine coverage in the year 2000, there was no measles in the United States. Didn't happen. But this is it's not limited to the US. There's plenty of cases in Mexico. Matter of fact, there's even more, some 3,000 cases, also linked to a local Mennonite population. And there's a lot of cases also in Canada as well, Ontario, Canada. And those were linked to cases in Michigan. And I think what the whole thing is now, besides, these 1 to 2 people that die, 1 out of every 8 cases of measles ends up in the hospital. So this ends up being a lot of people admitted to hospitals. People haven't seen necessarily measles for a while, and they end up getting admitted, and it's so contagious. Everybody who's at risk will get measles that comes in contact with that patient if they're not isolated properly. And of all the cases uh, that have been hospitalized, 28% are in kids under 5 years of age. And what's happened in the United States, because the pediatric diseases have been really well controlled, and so the number of pediatric beds in hospitals around the country has declined. They don't need them. Well, if this is going to be a big splurge, there's going to be a shortage of pediatric beds, or they're going to have to take up adult beds. But anyway, it's most likely what's happening right now is the epidemic of measles has kind of entered this whole unvaccinated at-risk group in the United States, and it's going to just continue at this kind of dull roar that you see here now. But it's certainly
Mhm.
not good, and it can be very devastating.
Absolutely. And like you mentioned, although there are fewer cases right now happening in Texas, where the onset of the outbreak was, it has traveled all across the country domestically, and we've brought in cases and probably
Yep.
exported cases internationally. So
Oh yeah,
just
people
not great.
from abroad, they're traveling, they're not vaccinated. They go to a place with an even higher measles rate, like in Mexico, some of these places. And they're bringing it back.
Mhm. Now, another topic we have been,
There have been 9 deaths in Mexico alone reported.
yeah, which is very high. You said that 1 to 2, 1 to 3 number per 1,000. So that's at the high end for Mexico there.
Yep.
Now, another topic we have been following very closely is H5N1 avian flu. Over the past couple of weeks, we've been seeing some cases here and there in Asia. I understand there was another one that popped up, and there's also some streamlining of the reporting from the CDC here in the US. Can you bring us up to date on those?
Yeah, so Cambodia now has 12 reported cases. It's probably very underreported there, but in their reporting, it is up to 12. 6 of those have died. This is where this 50% death of avian flu has comes from Asia. Um, and Cambodia is reporting these cases now. Now, in the United States, the number of cases appears to have been slowing down. Now, this could be because of increased prevention measures, or it's just, just not at as much risk or whatever. But looking at the 18,000 people monitored after exposure to infected animals, more than 880 tested after exposure to sick animals. And, they only found 64 were detected during the targeted surveillance like that. So that's a pretty low amount. And they only found in massive surveillance, where they're just testing people, maybe dairy workers, but, not associated with sick animals, they only found 6. So it's hard, it's more difficult to transmit. But again, the risk here is that if this mutates and becomes easier to transmit, which is totally possible, then we're in trouble. So, but right now, things are pretty stable in the human population in the US, getting unstable in Asia, and still a problem, especially with birds. Some 175 million commercial and backyard birds have been infected and culled.
Not good news for the birds there. We'll keep an eye on this here in the US and all over the globe. But some good news coming out of Switzerland, actually, is that there was an approval of the first ever malaria drug for newborn or underweight children. Can you tell us about that?
Yeah, this is from Novartis, a Swiss company, and they have a drug called Coartem Baby. So Coartem is a combination drug used for malaria in adults, but of course at an adult dosage. And it has not been used in or approved in children yet, but it now is. I've taken the drug myself. If you live in Africa or work in Africa full time, it's very difficult to take the prophylaxis medicine that if you travel to a malaria area, they're going to give you Malarone or something. They're going to give you some drug to take to prevent getting malaria. The first time you get malaria, child or adult, is very, very sick. First time I got malaria, I really thought that was the end. But anyway, I've had it a few times, and so what you do, especially as an adult, you built up some immunity. Most of the people that are dying from malaria abroad are children, because they don't have the immunity built up yet. And you take this Coartem drug. And so now it's available for these kids. So there's about 30 million babies born in Africa's high burden malaria countries every year. There's no approved treatments for babies less than 10 pounds. And this was a big gap. Malaria, now the gap is filled. Malaria is the deadliest disease in Africa, whose 1.5 or so billion people account for 95% of the 600,000 malaria deaths worldwide per year, according to the WHO, and 3/4 of those deaths are among children. So it's very devastating. So this is great.
Yeah, excellent news. And while we're on the topic of mosquitoes, experts are also bracing for more dengue fever cases this year. We talked about it a lot in the past, but can you bring us back up to date on what's going on there?
Well, like measles is becoming endemic again in the United States, so is dengue. There were about 3,700 new dengue infections reported last year in the contiguous United States, and this was up from 2,050 cases in 2023. So it's almost a doubling. Of those cases, 105 of them were contracted locally in California, Florida, and Texas. The rest of them people got because they were traveling and they brought it back. It's not transmitted person to person. But 105 cases treated locally. In 2023, for example, there were only 250 new cases, less than 10% of what we're seeing now, including 2 acquired locally. I remember when those 2 cases were noticed, that was a big deal. Oh, you can get dengue just living in the United States. And 2024, just last year, California had 725 new dengue cases, including 18 acquired locally. So it's just dengue is also endemic and is likely to grow. So it's endemic in many warmer parts of the world, including Latin America, India, Southeast Asia. And it increased markedly last year in many of those places, especially Central and South America. There seems to be this every 4-year big bump, and then it kind of goes down, and it's a little bit of a wave. So there was the big wave in the last couple of years, but this year is not projected to be a big wave, but it's now endemic in the United States.
Yes, so something to be on the mind of clinicians, something to be looking out for. Most people infected with dengue do not have symptoms, but those that do can get very, very, very sick.
But yeah, and if you have it more than once, it can even be fatal.
Scary stuff. But
Cheery talk today,
yeah,
but
cheery talk, but important, important news. So thank you so much, Dr. Murphy, for your time and your expertise explaining this all to us and helping us understand why it is so important.
right. Well, thank you very much, Katie, and have a great weekend.
Thank you, and thank you all for joining us for this week's episode of the Ask Dr. Murphy series. Thank you for your questions and comments. Please feel free to submit any more that you have, and we'll see you next week. Bye-bye.